Hello everyone, welcome back to my YouTube channel. Today I am so excited to have Brad Smith. Dr. Brad Smith is the legend dentist that I found him through LinkedIn, Facebook, and Instagram and everything. And Brad is an amazing dentist. He's a graduate from UOP, and also he got a lot of common of interest. He does what I do similar, but the way I do is different. I create the medical dental network for dentists. But what he does, what I do is yearly, once or twice it's a year event. But Brad is different. He came up with something very unique, and today I'm uh, finding out what exactly his Halo Dental Network is. So Brad, welcome to our show.
Hey, thanks so much. I appreciate you letting me on and reaching out, and I am always happy to talk to people about how to, do charitable service effectively and with the highest degree of impact.
Absolutely. My work is I do once or twice a year. It's cool, it's nice, but what I see is some evidence that you provide amazing work, and other dentists that in your group provide some amazing work in the case before and after with the very targeting individual one-on-one kind of dentistry. And can you explain to us about what Halo Dental Network is all about, and why you're doing it,
Yeah,
and how did you come out about it?
of course. Yeah, thank you. So, HALO is actually an acronym, and it stands for Helping and Leading Others. And that's what we try to do for dentists who want to find the most impactful and effective ways to give back to their communities. And we do it by allowing dentists to essentially do at least one case a year in their office, fully comprehensive, without it costing them any money.
Wow.
So most dentists, I would say a lot of dentists, I would say probably most dentists want to do charitable service. They want to use their skills to help people who cannot pay for it, right? They can't afford it. And they want to help these individuals. So we help dentists find their patients, or the dentist can find their own patients. If they can't find their own patients, we help them find. We got lots of patients in need of these services, and then we do it so that all the dentist has to do is donate their time. They do it in their own office,
Mhm.
which is super important. They don't have to fly or travel anywhere. There's no Halo headquarters. The headquarters is your office.
Mhm.
So you get to stay in your office. You get to expose your whole team to this type of charitable service, and choose someone that lives in your community to do this service for. And we donate all the materials. We donate all lab services, and we make it so that it doesn't have to cost the dentist out of pocket. And what we find is that once we can eliminate those barriers, a lot of dentists are very much on board with wanting to help us do more cases.
That's beautiful. Hey, you guys, did you hear that? Everything can be free. All the material, all the lab work that you plan to do for the patient would be provided by Halo Network. And can you please tell us some more about what are the rewarding that you have received, or other dentists receive from this kind of network, rather than having your own idea doing the same thing? But what the difference between an individual dentist who create their own charity on their office versus the army that Halo Dental Network that you are envisioned for yourself, for your company, or your organization?
Yeah, so there's a lot of perks to joining the Halo Dental Network. We have a lot of companies that sponsor us. For example, Biohorizon is an implant company. I think Biohorizons is the fourth largest implant company in the
Yeah.
world. They are owned by Henry Schein,
Mhm.
and they donate all biologics, and they donate all implants and implant materials. They even donate a surgical kit which you can use for the case. And so that's pretty awesome. We also partner with the philanthropic arm of Henry Schein, which is called Schein Cares. And they have donated a curing light and a handpiece. So we have a Cavo Smart Torque handpiece and a Blue Phase G4 curing light from Ivoclar that gets donated to the dentist. The dentist gets to keep those two items, which is like, I think it's about $1,800, $2,000 worth of items there. And that's a really nice perk for the doc. We also have a production crew, a video production crew that will help you capture the moments of you changing this patient's life.
Wow.
Tell the patient's story, put it into a very well packaged commercial, essentially, that you can use for your office. And this is something that, you know, dentists spend a lot of time trying to figure out how to set themselves apart. You know, dentists want to be different from other dentists. We want to show you want to show your patients why you're different. And boy, that's hard. That's hard to do. But this is one way that Halo provides for all the dentists that volunteer, is that we will create a promotional video, 3 to 5 minutes long, that will showcase the case, showcase the story of the individual that you've helped, showcase the doctor, showcase the doctor's office, and give the doctor an opportunity to tell the world and all potential patients why they do what they do. And this will immediately endear patients to your practice before they even meet you. It's incredible how this works. And so that is another perk that you own as a volunteer of the Halo Dental Network, is you own this video. We give you a video, you own it. You can use it for your social media, website, put it on a loop, on a monitor in your office, however you want to use it, but it is high quality and it's very effective in helping the patients understand who you are and why you do what you do. So that's one of the most incredible values of Halo Dental that we bring to the docs who volunteer for us. In addition to that, we have a very large social media presence, something like 150 to 170,000 followers across all of our platforms. And docs have access to that. We do shout outs to all of our doctors and all of our sponsors. And we help get the word out of who they are, what they're doing, and why they're doing it. So that's the gist of Halo. In addition to the whole reason why you should be doing this is just the personal fulfillment that you get from helping another person, right? Like that's something you definitely are going to get.
Yes.
But in addition to that, like just the good feeling you get, you're going to get the all these added perks as well: the handpiece, the curing light, the video, social media, social media networking, all those wonderful things.
I just want to make sure you guys hear it again. You guys, it's the surgical kit from Biohorizons. That probably, if you buy it individually, about 5,000 or something, right? And then the implant. How many implants that they're gonna give?
As
12?
many as you need.
Oh wow!
As many as you need.
Do you guys hear that? As many.
You
as
place
you
12, they'll give you 12. Yeah,
Okay.
they'll supply all the implants for the case. The surgical kit is a donation from Biohorizons, and that is the only thing that you don't get to keep permanently. They will ask for the surgical kit back, but they will also give you a deal, a really, really good exclusive deal through Halo to purchase their products, and it will come with a kit if you decide to utilize Biohorizons in your office. But everything else comes permanent for the doc except for that surgical kit. You get to use the kit for the case, but it is not. They'll ask for it back.
I see. Now, you guys, the Biohorizon is a very, very reputed company, implant company. So if you ever try it, this is the opportunity to try it, right? I mean, what else can you get?
I use them. Yeah, I use Biohorizons. I use Biohorizons in my personal office. I place 300 to 400 implants a year. Love Biohorizons. I think it's one of the greatest products out there. So you get a little bit of exposure to the Biohorizons products, which is very nice. But if you're a Halo doc, you do not have to use Biohorizons. If you have a different implant company that you like, and you can get them on board, Halo will not broker that relationship, but Halo will absolutely allow you to use whatever implant company that you want. Okay. We just have this relationship with Biohorizons where it's an automatic. They'll supply everything that you need. That includes locator abutments, healing caps, abutments for crowns. They'll supply all the biologics, bone graft material, membranes, anything that you need, they'll supply all that stuff. And that's automatic. But if you feel more comfortable utilizing a brand that you are using every day in your office, we absolutely will still, to do the case with you. But you'll have to tell them what you're doing, and we just can't provide the product to you for free if you're using a different company.
Sure. Brett, other people have questions. For example, like they love the idea of joining your network, but they worry that after the case done, how do they supposed to follow the patient, or what should they? Is there an obligation to follow through? Years after that? Can you explain to what in your process?
Yeah, the whole reason why we're choosing this patient is because they can't afford the dental work.
Mm-hmm.
So in many cases, even monthly cleanings may not be something that's in their budget. So we ask all of our Halo docs to include 2 free visits a year, to include cleanings where applicable. So as a Halo volunteer doc, we're going to ask you to agree to 2 free cleanings a year for life for these patients. One thing we absolutely do not want, and this is a heavy criticism to any charitable dental organization, is we don't want to do a bunch of dental work on somebody and then not be able to follow through with the maintenance that is required. It's like if you were to gift someone a car and they can't afford doing the oil change. There's certain maintenance that's required that we all know as dentists. And so we have thought about that, which is why we put those requests in place for the docs to make sure we include that. So these patients should be welcomed into your practice with open arms once every 6 months to have their teeth cleaned, so you can check up on the work. And I don't think this is any different than if you did a normal case. Like if you did a big case in your office for a full paying customer, you would want to see them every 6 months to follow up on whatever you did.
Right.
So to me, it's like, it just doesn't skip a beat. It's exactly how normally you as a dentist would handle this kind of patient in this kind of case. The only difference is we're gonna waive all the fees.
Now, when we actually treat the patient, do we use the consent form of our office or consent form from Halo Dental Network?
Yeah. Halo is going to ask for, because we share a lot of these cases and photographs on social media. Halo asks for a social media waiver, which includes a HIPAA waiver. So all patients will waive their HIPAA rights, and then also the ability to post these on social media. Which the reason we do that is so that other people can, have a exposure to how incredible what we do is, right? Like, we want to tell the world how transformative the power of dentistry is. Well, we can't do that without patients consenting to allowing us to share their story.
Right.
And most patients are over the moon thrilled to be able to do that. And most doctors are thrilled to be able to do that as well. So, the idea of why we share on social media, why we tell the stories to convert more people to the power of charitable service, and how important that is, and how life-changing that is, not just for our patients, but it's life-changing for the docs too, to understand how much that gives you. There's an added purpose. Dentistry is hard, right?
Yeah.
Dentistry is really hard, and it can't be about money. And I know many, many dentists who do very well financially, who just don't feel fulfilled by the dentistry, the day in, day out of dentistry. In fact, they feel the opposite of fulfilled, even though their paychecks are substantial.
Right.
So being exposed to the charitable aspect of what we do, and doing things for people who can't do it themselves, even though it's the same physical job, still cutting a crown, you're still placing an implant, you're still pulling a tooth. But when the purpose is changed, it changes your own purpose of why you do dentistry. And all of a sudden you might feel very excited to go to work because of what you're doing and why you're doing it. Because it's not for the money anymore. It's a changed perspective. And that's a very powerful component to dentistry that you can go your whole career and completely forget about. And so that's what we're trying to do, is remind dentists, like, this is, you became a dentist likely to help people. And that is something we want to bring people back to.
So Brad, in the same token, would you give some dentists out there, what were your personal experience that you changed somebody's life in the past, and what were the instant ramification, and how do you how were the interaction or conversation that you had after you finished those cases that personally that you did it on those patients? What were your story behind?
Well, I'll tell you, if you go back to so I graduated as a general dentist in 2009, which was 13 years ago. I graduated from UOP, like you said. And I would say 5 years in, about 5 years into my career, I had to admit to myself that I didn't like my job. I didn't like dentistry. And I had to do some personal inventory of what it was exactly that I didn't like. And one thing was dentures. Side note here, not before we get to the charitable service, I hated doing dentures. So I stopped doing dentures. Made a huge difference in my life. And some people love dentures, and more power to them. Maybe it's something else you don't like doing. Maybe for some people it's root canals or pulling teeth out or fillings or whatever aspect of dentistry. Right. I had to really identify, like, oh, dentures was a source of a lot of stress for me. So I cut that out of my life. I also identified that the people I worked with I needed them to be on the same page as me, and they weren't, and I wasn't addressing that. So I had to address that, and I had to get rid of people and talk to people and confront people about that. And the third thing that I realized I needed to change was that I wasn't doing anything for anybody. I wasn't helping other people. I wasn't providing any charitable service to anybody. I wasn't using my skills. When someone couldn't afford a crown, I just let them leave the office. And so little by little, I started changing that. And that was the biggest difference maker for me, was every now and then someone couldn't afford a crown. And I would just, I'd like the patient, like we all have patients that we like that just aren't going to buy that. They're just not pulling the trigger on the crown we keep telling about, right? We keep on saying, you're going to need a root canal if you don't get a crown. And you keep on telling that, they won't do it. They don't do it. And they don't do it. And then sure enough, they need a root canal. Then they can't afford that. So you pull the tooth. So we all know that as dentists, we know how that plays out. So I started telling people when they couldn't do it, I would just say, well, hey, how about you let me just take care of this one for you, and you can take care of the next one. And they would say yes, and they'd be blown away, because $1,000, $1,500 crown, whatever your price is on a crown, that doesn't move the needle for us as dentists like it does for the patient. Right? Like the patient saving $1,000, that might be, their rent for the month. Right. What we feel, I mean, how much does it cost us to do a crown? $150, $200, man. I mean, like, it's just not something that we feel. If you're being really honest, if you know your numbers in your dental office, know that one crown is not going to make or break your paycheck. It won't move the needle for you one bit. And so when you realize that, you start doing these things, it makes a big difference. And then you look at other things that are like even easier, like a root canal doesn't cost nearly as much for us, like our costs, as a crown. It's a much lower overhead procedure. Deep cleanings, hardly any overhead there, right? Pulling teeth out, hardly any overhead. So you have all these things that you could do that actually don't cost you even less than a crown, that are still very meaningful to patients. And the coolest thing is what I started noticing was that these patients became my cheerleaders. Like, they go back and they don't tell. Here's the worry. Dentists have this worry that, like, well, if I do a free crown for you, then he's going to tell everyone I did a free crown, and then I'm going to have 20 people lining up at my door asking for a free crown. This is this weird paranoid type of concern that dentists have. And I have never once experienced someone coming to my office saying, you did a crown for so-and-so, and now I want a free one, just like you gave him. Right. What I do notice a lot, and I mean a lot, is that these people tell the world how amazing of a dentist I am. They go out of their way to tell people, go see Dr. Brady. Go see Dr. Brady at his office. He is such a cool dentist. They do not want to tell people that they got their crown for free. No one wants to tell people that. That's not in the human nature to tell people that your crown was free. All they want you to know is that this dentist is awesome. He's so nice. He's so trustworthy. He's a good guy, good gal. That's what they want to know. And doing these little bits of service are really helpful. And then that progressed to me doing more and more dentistry. I liked it so much. So I started doing more. And that progressed to full cases. And that cost me lots of money. And that bothered me, that it was costing me, I like to do them so much, but man, it would cost me a couple $1,000s to do these cases. I started getting for my own personal, this is before Halo ever started, I started getting like my implant company involved, my lab involved. And then I was like, man, every dentist should be doing this. This is so helpful. And so you go back to where I was feeling like 5 years, I hated my job. I told my wife, I hate my job. I told my wife, I don't know if I can do this. And you and I both know dentistry is not a career that you can just 180 and drop and do something else.
Right.
I mean, I was, $300,000 in debt, and we bought a house, and my wife was pregnant and having babies, and like I needed the income. And I love my job now.
Mm-hmm.
And I know that if I start getting drained, if I start running into, the burnout, I know that for me, I start looking outwardly to other people who I can help. And that re-energizes me, man. That gets me out of a slump. That gets me out of my burnout. And because I forget who I am, and I just focus on who my patients are, right? I forget little poor old me, and I start just diving straight into how can I be of service to other people? And then that redefines my purpose. And then all of a sudden, I like going to work again. And that's what I want. That genesis of Halo comes from, was my own personal experiences, and then wanting to be able to share that on the biggest scale that I can possibly create. So that's what we're trying to achieve. It's super ambitious. We want everyone to be a part of it, and that's why I'm super excited that you reached out.
It's beautiful, Brett. I agree with you. When you give out, you will receive it back. It doesn't have to be from that person, but it's just from just somewhere else gonna come over back to you. And same experience that I have, and that's the reason why, when I searched and I found that what you've been doing is so wonderful for people, not only in your town but around the waking up those dentist army that we're gonna build something like this for not only just this generation but hopefully several generations down the road, and build this is the army of helping people. And it's beautiful, and it's rewarding, professionally rewarding, personally rewarding, and spiritually rewarding. That's what I believe too.
Yeah.
Can you repeat again Halo stand for? What Halo stand for?
Yeah, helping and leading others. So we are helping obviously patients.
Yes.
And trying to be leaders in our communities. And also I believe we're helping ourselves, and we're helping our whole profession. I don't know if you've noticed this.
Yeah.
But I've noticed certain headlines that make the news about people who do things they shouldn't do, or like negative headlines. If it's ever a dentist, it's very specifically mentioned. Like I always remember the dentist who killed Cecil the lion. That made national news. I don't know if you remember that.
right.
But it wasn't just like an American who killed this beloved lion. It was an American dentist killed this beloved lion. They always, and it's not just that story. It's a lot of stories.
Yeah.
We are just, as a profession, we are easy to hate on, right? We are easy for people to be like, oh, those shady, grimy dentists, the money hungry, rich, affluent, super privileged dentists. It's just easy. And so I dream, I know it's ambitious, but I dream of like an organization like Halo that allows us to be beyond reproach of those types of criticisms, that we as dentists have created our own charitable organizations that take care of the people who need to be taken care of, right? Take care of the people, find the most deserving people, and we take care of them. And that's what I wish dentists could be known for. But it's going to take a lot of people putting their hands together and helping out. And but if we have enough people that do it, I mean, man, imagine if we had 100,000 cases a year. I mean, imagine even 100 is impactful. I mean, imagine if every dentist, I think there's 250,000 dentists in the United States. Imagine if every single one of them, or even half of them, or even 10% of dentists did a Halo case, and we could share that with the world. It'd be incredibly impactful and super uplifting for our profession and the way that we are viewed by the public. And if we could gain more people's trust, then we can do more treatment and we can help more people.
Amen. You answered me those questions that I was going to ask you, like how you would envision yourself or your company, your organization in the next 5-10 years, and I agree. And then imagine if the number of people going to help to grow the appearance of our profession into the next level of not only just doing dentistry for money, for finance, but to change the image of how the people perceive us. That is incredible.
Yeah, and most dentists, it's true, we do well financially. I would say most dentists are doing just fine. And so something has to come after that. You've established yourself, you have your practice, you got your well-oiled machine. Even if you're an associate, you're getting your groove. You know what you're going to produce every month. Your paycheck becomes pretty stable. You're making your bills and you have extra. You can go on vacations. You can buy a nice house. You can buy a nice car. And then something has to come next, because I can just tell you, I feel like anyone listening to this knows, the people who have it all and still are unfulfilled. And this is the next step after you've established yourself, is you help yourself and then you help others with what you can. And, I mentioned before, like doing a crown is a big deal to a patient, but not really a big deal to us, right? We don't feel that sting financially if we do a free crown for somebody. A full mouth case is even more exaggerated. You tell a patient $30,000 to fix their teeth, and there's a lot of people in this country that you might as well be telling them $30 million, because they're not going to be able to do it, right? $30,000, they're just not going to do that. So be able to give that to them, and then then they can get relationships and job opportunities and confidence that carries through their entire life because of one person swooping in and helping them out. I mean, the cascade of good things that will happen to people is just infinite, in my opinion.
Yes. So, Brett, real quick, let's say somebody who listening to our conversation and they say, well, I just want to do crown for patient. I want to do filling. Is there any kind of limitation what Halo Dentist can provide, or is there a free kind of choice that the doctor want to do, pick and choose,
Yeah. So thank you for bringing this up. That's a really good question, because a lot of dentists may not feel comfortable doing full mouth cases. A lot of dentists might not feel comfortable doing surgery.
Right.
And depending on where you are, and depending on what we do, we will work very hard to allow every dentist who wants to volunteer to the best of their capability. We do require that all cases that we do are comprehensive in treatment. So we are not doing half cases. And that doesn't always mean that implants have to be involved. I've had dentists that just do a denture. They pull people's teeth out and put dentures in. And for a lot of people, that's helpful, and that's what they can do. And that's helpful for the patient. We also have the ability to hook you up with specialists. We have a lot of relationships with oral surgeons and periodontists and endodontists and orthodontists who can help us take care of some of the more specialized facets of dentistry. Whereas if your only problem was you don't feel comfortable with dental implants, but you feel comfortable with everything else, don't hesitate to, let us work with you. We will find specialists in your area. We might ask you to help us to find these specialists, but we will contact them and we will ask them if they want to be involved in the Halo Dental Network, and then avail all of our resources to the specialists. And the specialists are in the same situation, because what's cool is that a specialist, an oral surgeon can't do crown and bridge, right?
Can do a denture.
So Yeah, I get these questions from the specialists who say, "Hey, I really think Halo's kind of cool, and I want to help out, but I'm a surgeon. That's all I do.
Mhm.
How can I can't really do a full mouth case because I don't restore anything. I just place the implants. I don't do any restorations. And this is a perfect marriage. We'll
Okay.
find a specialist that wants to participate. We find a general dentist that wants to participate, and we just try to match those two together as best we can. And then the patient just goes to two docs. I mean, obviously, logistically, it's a little more difficult for us, but we are happy to make that logistical effort to make this happen for someone. But just to answer your question, we would not approve a case through Halo if it was just doing a couple of crowns in a mouth where you need all of them. It is important that we all make an effort to be as comprehensive in this treatment as we can possibly be. We don't want to do half measures. We want to do the whole thing, get them completely restored, and then try our best to maintain that throughout their life.
What about for the orthodontist, Brett? If they say, "Hey, this is excited, I might want to join Halo Army to do braces for the K," is that something that they can join you guys?
Absolutely.
Yeah.
So yeah, we'll take on it. We love specialists. Specialists open up our ability to do more cases, right? More complicated, specialized cases. We don't, it's great that we don't have to rely 100% on general dentists. We can rely on general dentists. And again, it's the Halo Dental Network. It is in the name. It's a network of dentists and dental specialists that are working together to help and lead others. And that's the name of the game. So absolutely, if you're a specialist listening to this and you think, well, I don't do general dentistry, we can absolutely still use your help if you want to volunteer to be part of the network.
So basically, you guys, if you are a specialist, you can be part of the team, and that it's gonna build a relationship between you are a specialist and the general dentist. It's a really good relationship that if you can build a case together, and that will really transform somebody's life, but also transform your community. And so I encourage you guys to check out what the website, Brett.
Yeah, the website is halodentalnetwork.org. We also have a lot of you can look it up as the social media as the Halo Dental Network on Instagram. There's also me on social media. I do a lot of personal stuff on social media. Dr. Brady Smith on Instagram, Facebook. We're even on TikTok. We are big on TikTok, actually.
Cool.
We have quite the presence on TikTok. Also, Dennis, if you're sleeping on TikTok, I highly recommend you don't. TikTok is a very fast way to grow an audience if you have decent content out there. There's a lot of misinformation about dentistry. There's a lot of, just in general, people just don't understand what we do as dentists. It's very, very common that people just have zero clue what the most basic things to us are. Root canal. How many times has someone asked you about a root canal and says, "Don't you take the roots out on the root canal?" Like, people don't know. So these are great. So check us out on social media. Also, if you're not ready to volunteer your services, we love financial contributions. You can donate through the website as well. You can donate monthly, so you can do a small donation. If you don't want to do a lump sum, you can do a smaller donation, $10 a month, $20 a month, 100, whatever you feel comfortable giving. And 100% of the proceeds goes towards making these cases happen and helping dentists do this. So those financial contributions are, the lifeblood of Halo and are much appreciated. And it helps us continue to do what we do.
Brett, in the long-term future, do you have any plan or vision that, because you are one of the leader of the organization, would you like to have some other dentists or specialists who want to involve with you in the leadership team to grow your organization bigger, stronger?
That is a great question. And the answer is 100% yes. We have a small team right now. We have an executive director who is fantastic. We got a social media director, and she's fantastic. So we just have a small team helping us out. But as far as leadership or, the way 501c3s are organized, it would be board positions, right? Or or there's a lot of different roles within a 501c3 nonprofit, but definitely we are always actively looking for people who want to be actively involved in the Halo Dental Network, help us grow and take on leadership roles. And if anyone listening to this thinks that that's something they want to do, please let me know.
Yep, because this world is no longer just when in the internet world, so there's an opportunity to get to meet your team on Zoom like this, and it's all that's all it takes. So I encourage you guys to reach out to Brad Smith, and I'll put some information on the broadcast today. And yep, Brad, you have a couple of minutes to say the last word, and thank you very much for joining today.
Oh, thank you so much. Yeah, I think we've said it all. It's just about getting out there and helping people and letting dentists know that this is a tool, that Halo is a tool for you in your practice. It's a wonderful tool to have someone, you go to work someday, and instead of feeling sad about presenting this full case for this really cool patient and you'll never be able to do because they're never going to be able to afford it. Now you have the tool to actually do it. And because you might see that patient and be like, well, I know I'm going to make a difference in their life if I could do this. And now you can make that happen. At least once a year you can make that happen. And that's what Halo is. And that's what Halo is for dentists. It's a tool for you to use. And this will help you grow your practice. This will help you avoid burnout. This will, get you a few perks with those a handpiece and a curing light from here and there. We're always working with new sponsors. There's a growing desire to be a part of Halo from sponsors and dental supply companies.
I can see that.
And it's a very mutualistically beneficial relationship that we have with them. So yeah, I just appreciate you letting me come on and let me talk to your audience and you.
Yeah.
And I look forward to working with you more, man. This will be great, and get some more dentists involved.
Absolutely. This is going to be wonderful. Thank you so much again for your time today. You have a wonderful day, brother. Take care.
Yeah, you too.